Welcome to Time Warner Cable's Local Edition. I'm Brad Pomerance. Thank you for joining us. Our guest is U.S. Congresswoman Judy Chu, and I want to speak with you about MediCare. The Republicans recently held their national convention, and as part of their platform, they support an idea that MediCare should be doled out through vouchers that can be used to shop for private insurance. That really is the Paul Ryan plan, one of your colleagues in the House. What do you think about that plan?
That plan would end Medicare as we know it. It would provide a fixed amount of funds for seniors to take care of their medical expenses. Over time, the cost of medical care would increase and seniors would pay more out of their pocket, $6,400 more.
So as I understand it, we hear the term COLAs, cost of living increases. The COLAs, if that's what you want to call them for this voucher, would not rise with the cost of medical care because we know medical care has been soaring beyond the rate of inflation.
That's right. It could not keep up with the cost of medical care. This is the problem with it. And in essence, seniors would have to choose between food and paying for their medical expenses.
I'd be interested to know what your colleagues from Florida think of this. I mean, have you spoken with them, Democrats and Republicans? Because that is a state, I mean, look, we have plenty of seniors in California, but I got to think that issue is really being injected into the presidential contest. Have you heard?
Well, AARP is very much against the Paul Ryan Medicare plan, and there's so many seniors in Florida. So many seniors are against this plan because they like their Medicare. In fact, they say, don't mess with my Medicare.
It's interesting that a plan which is truly government run has become so popular, yet the Affordable Care Act, which is really not a government-run plan as I understand it, is being attacked as government-run. I mean, it's a complicated scenario. I do want to ask, though, about the Affordable Care Act, the Obama plan. Yeah. What Romney Ryan is saying is that they want to restore a cut of $716 billion from Medicare. I understand there's some confusion on that issue. Could you, from your position, tell us whether you believe that is a fair restoration?
Actually, it is a foolish restoration. The cuts that were made in the Affordable Care Act to Medicare had to do with fraud, waste, and abuse. And they were excessive amounts given to private insurance companies to deal with Medicare. And also there is fraud, and this crackdown.
So it's not a spending cut. There is no spending cut. There's no $716 billion being cut from Medicare. The hope is that through efficiencies, improved quality, that will be a savings.
Exactly.
But is that realistic? I mean, that's a lot of money to save through efficiencies and improved quality.
Well, there is supposed to be a board that is going to be set up that would look and assess the situation and make recommendations if the funds don't reach the promised amount.
I do want to ask you more about the Affordable Care Act. The Republicans in Congress have talked about repealing the Affordable Care Act and replacing it. And I'm wondering if you've had a sense as to whether they've presented the replacement. Because I try to follow the issue. I haven't heard of the replacement.
That is a very good point because they don't have a replacement. In fact, we would end up back in the situation that we're in right now where you get denied health insurance even if you want to buy it because of pre-existing conditions. This is not right.
What are your voters saying in the San Gabriel Valley about the Affordable Care Act? Are they understanding it more and better, whether they're in favor or opposed?
Well, there are mixed results. Some really understand it and they say, this is exactly what we need. Others don't quite understand it, but if you break it down and say, well, do you think kids should be covered up to the age of 26? Do you think you should not be denied because of a pre-existing condition? Then they agree.
Individual elements become popular.
Exactly.
Her name is Judy Chu, member of the U.S. Congress. I'm Brad Pomerance. Thanks for watching Time Warner Cable's Local Edition.